There is a difference between having polycystic ovaries and having been diagnosed with polycystic ovarian syndrome. PCO is a variant of normal ovaries. PCO refers to an ultrasound scan image of the ovaries that appears to be polycystic. That is, ovaries contain high density of partially mature follicles. PCOS is a metabolic condition that may or may not come with having polycystic ovaries. Having polycystic ovaries does not mean you have PCOS. In fact, to meet the diagnostic criteria of PCOS, women need to have 3 qualifying criteria. Number 1, irregular periods. Number 2, signs of increased levels of androgens, that is male hormones, such as excessive hair growth, acne or hair loss. Number 3, enlarged ovaries with lots of small follicles containing immature eggs. PCOS is a syndrome or a group of symptoms, so just one sign or symptom is not enough for a diagnosis. Many women may have polycystic ovaries but do not have PCOS. Studies have shown that most often women had been incorrectly diagnosed based on irregular cycles alone or on an ultrasound showing polycystic ovaries. Another important fact to note here is that some women may have multiple ovarian cysts in their ovaries which are different from cysts seen in polycystic ovaries, and these women don't have the problems associated with PCOS. More than half of the women affected do not have any symptoms. PCOS is associated with a range of symptoms, namely acne, male pattern of hair loss, excessive hair in the rest of the body, obesity, etc. But it is important to note that a woman don't show all the symptoms, and the severity of the symptoms also vary from one woman to the other woman. Women of different ethnicities, for example, have different amounts of facial and body hair texture. Also, there are several other factors and conditions that can mimic PCOS symptoms, such as stress, hormonal contraceptives such as the pill, obesity, thyroid issues which can affect metabolism, over-exercising and disordered eating. Many women end up matching symptoms and doing self-diagnosis, which is very harmful because an incorrect diagnosis prevents them from seeking the right treatment at the right time. Some women with PCOS may have trouble conceiving naturally and may need medication to help them ovulate when they want to conceive. But many women with PCOS do conceive spontaneously and achieve their desired family size. In fact, women with and without PCOS have found to show similar numbers of children. On one hand, there are women who believe in this myth that they can't conceive because of PCOS and hence take the risk without contraception and end up with unintended pregnancies. On the other hand, there are many women with PCOS who believe they won't become pregnant and live with the fear of infertility and feel pressure to conceive early. So I would like to reassure that most women with PCOS can conceive naturally, and if there are issues, they can conceive with medical assistance. While many women with PCOS report difficulty in losing weight and perceive a greater susceptibility for weight gain, weight management interventions such as diet and behavior change programs have found women with and without PCOS lose the same amount of weight. A recent analysis suggests a high BMI is one of the causes of PCOS, with weight gain making symptoms worse. But having PCOS does not appear to affect BMI. Encouragingly, even a small amount of weight loss can improve PCOS symptoms. Optimizing healthy lifestyle, that is eating healthy, being active and avoiding smoking, is the first line of management for women with PCOS. However, women with PCOS may face additional barriers to implementing these changes, such as higher levels of anxiety and depression, highlighting the importance of access to support. Among women with PCOS, each woman has different contributory factors and therefore different levels of risk. PCOS women need a holistic treatment regimen that combines weight loss, nutritional guidance, mental health therapy with medical management to better manage their condition, improve their outcomes, and reduce unwarranted anxiety. PCOS is associated with an increased risk of developing insulin resistance when the body doesn't respond properly to the hormone insulin. Type 2 diabetes and metabolic syndrome, which is a collection of factors such as high blood pressure and poor cholesterol levels. Consequently, some women with PCOS report persisting anxiety about their long-term health. However, the potential consequences are not the same for all women diagnosed with PCOS. women who show no signs of androgen excess, that is, those women who are diagnosed due to irregular menstrual cycles and polycystic ovaries, do not have the same metabolic risks as women with androgen excess.